Think about the last time you were genuinely worried about your health. Not a passing ache, but the kind of worry that keeps you awake. The kind where a doctor says the words, "We should take a closer look," and suddenly everything in your life reorganizes itself around one appointment. In that moment, what do you actually want? You want to be seen quickly. You want the person looking at your images to be an expert, and you want somebody to explain, in plain language, what they are looking at and what it means. That sounds simple. It is astonishingly rare. Welcome back to the next Biz Thing, the show where I go looking for the businesses quietly building something better in their corner of the world and then tell you why it matters. I am Markus J. Diploma, and today we are going to Wolfsburg in Lower Saxony, Germany, to spend some time with a business that has taken one of the most technical, most intimidating corners of medicine and made it feel human again. The business is Diagnostikzentrum Radiologie Wolfsburg, and their own description of themselves is your center for modern diagnostics and individual care in Wolfsburg. Hold on to that word individual, because it turns out to be the whole story. Let me set the scene. Diagnostic radiology is the branch of medicine that produces the pictures everything else depends on. Before a surgeon operates, before an oncologist plans a treatment, before an orthopedist decides whether that shoulder needs a scalpel or 6 weeks of physiotherapy, somebody has to look inside the body and produce an image clear enough to make that decision on. Radiology is the step where uncertainty becomes information. And because it sits so early in the chain, everything downstream inherits its quality. A blurry image, a long wait, a report nobody explains, and the whole process slows down while a patient sits at home imagining the worst. Diagnostikzentrum Radiologie Wolfsburg is a physician-led, independently operated practice on Hesslingerstrasse in Wolfsburg, and it is run by Dr. Med. Michael Au, a specialist physician in radiology. That phrase, physician-led and independently operated, is doing a lot of quiet work. In a healthcare landscape where more and more imaging capacity sits inside large groups and hospital chains, an independent practice run by the doctor whose name is on the door is a deliberate choice. It means the person setting the standard for how patients are treated is the same person reading the images. The practice describes what it does as combining modern medical technology with personal attention, and it names 3 things it cares about: quality, reliability, and a human way of working together. I want to take those in turn, because the technology side alone is genuinely impressive. Start with magnetic resonance imaging, the MRT. This is the workhorse of soft tissue imaging, and its great virtue is that it uses no ionizing radiation at all. It builds its picture from magnetic fields, which means you can image organs, joints, ligaments, discs, and soft tissue in extraordinary detail without any radiation dose whatsoever. For a patient who needs repeated imaging over months or years, that distinction is not academic. It is the difference between a scan you can safely repeat and one you have to ration. Then there is computed tomography, the CT, and here the practice makes a point of using low-dose technique. CT is unmatched for speed and for certain kinds of clarity, particularly bone, lung, and acute situations, but it does involve radiation. Low-dose protocols are the radiologist's craft applied to that trade-off, getting a high-resolution cross-sectional image while pushing the exposure down as far as the diagnostic question allows. It is not a setting you flip on. It is a discipline, and choosing to lead with it tells you something about how the practice thinks. They also offer digital X-ray, still the fastest and most accessible answer to a large share of everyday clinical questions, and mammography, including 3-dimensional mammography, which you may hear called tomosynthesis. That last one deserves a moment. Conventional mammography compresses the whole breast into a single flat image, which means overlapping tissue can hide something, or, just as disruptively, can create the appearance of something that is not there. Tomosynthesis takes a series of images from different angles and reconstructs them into thin slices you can scroll through, like turning the pages of a book instead of reading them all stacked on top of each other. In practice, that means better detection and fewer women called back for an anxious second appointment that turns out to be nothing. If you have ever waited on one of those calls, you understand exactly how much that matters. Beyond the imaging you might be sent for, the practice offers 2 preventive scans that patients can choose for themselves. There is a dedicated prostate MRT, and there is whole body MRT. These sit in an interesting and growing space in medicine. The shift from reacting to symptoms toward looking earlier, while things are still small and quiet. That shift only works if the imaging is high quality and if somebody competent interprets it, which is precisely why it belongs in a specialist radiology practice rather than anywhere else. And then there is the part that surprised me most, because it is not what most people picture when they hear the word radiology. This practice does not only produce images, it also treats. They offer periradicular therapy, known as PRT, which is a CT-guided injection delivered with millimeter precision to an irritated nerve root, often in the spine. The imaging is not the endpoint there, it is the navigation. The scanner shows exactly where the needle needs to go, and the treatment is delivered to that spot, rather than approximately near it. They also offer Risbestralung, a low-dose radiation therapy used for chronic, painful, non-malignant conditions, the stubborn heel spurs and inflamed joints and tendon problems that quietly wear down a person's quality of life for years. It is a well-established approach in German medicine, and it is often remarkably effective for exactly the complaints that resist everything else. So the capability is broad and it is serious. But here is what I find genuinely distinctive, and it is the reason this practice ended up on the show. They make a specific promise about the experience. Short waiting times, clear, transparent procedures so you know what is about to happen to you. Thorough consultation so you leave understanding your own results. And they describe how they want to meet patients in a phrase I keep coming back to: competent, empathetic, and on an equal footing. That last part is the radical bit. Medicine has a long habit of talking down to people, of treating the patient as the object of the process rather than a participant in it. Deciding instead that the person on the table is your equal and that they are entitled to understand what you understand is a real position to take. They back it up in a way I did not expect. The practice publishes explanatory videos so patients can see and understand what a given examination actually involves before they arrive. Think about what that solves. Most of the dread around an MRT is not pain, because there is none. It is the unknown. How long am I in there? How loud is it? Can I move? What if I need to stop? A short video answers all of that before you have even left home, and it converts a frightening appointment into a manageable one. That is not marketing. That is somebody thinking carefully about where the fear actually lives and going to meet it. They are open Monday to Friday, 8 in the morning until 6 in the evening, with additional appointments by arrangement, and they maintain a dedicated channel for referring physicians, which is the kind of unglamorous infrastructure that keeps a patient's care moving instead of stalling between practices. Now let me tell you why I think this matters beyond one town in Lower Saxony. There is a broad movement in healthcare right now towards scale, consolidation, larger groups, more centralized imaging capacity. Some of that is genuinely good, because expensive machines need volume to justify them and specialists need enough cases to stay sharp. But something tends to get lost on the way up, and what gets lost is almost always the same thing: The explanation, the unhurried consultation, the sense that a specific human being is responsible for you rather than a department. What Diagnostikzentrum Radiologie Wolfsburg demonstrates is that you do not actually have to choose. You can run high-field imaging, three-dimensional mammography, low-dose CT protocols, and image-guided interventional therapy, and still be a practice where the doctor knows your case and takes the time to walk you through it. The technology and the humanity are not in competition. They were only ever in competition because somebody decided the schedule mattered more than the conversation. And when a practice gets that balance right, the effects ripple much further than you would guess. A patient who understands their scan asks better questions of their next doctor. A patient seen quickly gets treated earlier. A woman who is not called back unnecessarily is a woman who keeps attending her screening appointments year after year, which is how these programs actually save lives. Good radiology, delivered kindly, quietly improves everything that comes after it. So here is my invitation. If you are in Wolfsburg or anywhere in that region and you have been putting off an appointment, or you have a referral sitting in a drawer, or you have simply been curious about preventive imaging and did not know where to start, go and look at what this practice offers. Watch one of their explanatory videos. See how it feels to have something in medicine explained to you clearly, as an equal, before anyone asks you to lie down in a machine. And if you work anywhere in healthcare yourself, take a look at what they have built, because there is a lesson in it about where the anxiety in your own process really sits and how cheaply it can be dissolved. That is Diagnostikzentrum Radiologie Wolfsburg, a practice proving that the most advanced diagnostics and the most human care belong in the same room. Thank you for spending this time with me. If today's episode gave you something worth thinking about, follow the show so the next one finds you and pass it along to somebody who would enjoy it. I am Markus J. Diploma, and this has been the next Biz Thing. Until next time, keep your eyes open. The future is usually being built somewhere quieter than you expect.